Welcome to Pre-Op Education. This class is specifically geared toward behavior health, and I'm so excited that you have made it this far. I'm so glad that you guys are here, and you're almost there. I know you've done a lot to get to this point, and we're excited for you. And so today we're just going to spend a little bit of time talking about how to prepare for surgery and what to expect after surgery. You might be asking, what now? You've done all this work, you've done your diets, you've had all your labs, you've done all of your testing. What more could they ask me to do? Well, all we want you to do now is start focusing on getting ready for surgery. How do you prepare yourself for surgery? We're going to talk about that today. We're going to talk about what to expect in terms of emotional coping and adjusting after surgery. We're also going to talk about relationships after surgery because we need to make sure that we're taking care of ourselves and others in our lives. We're going to talk about body image and what to expect in terms of how you feel about your body and what your body looks like to yourself. We're also going to spend some time talking about alcohol use because I want to make sure that you understand how to take care of yourself and make sure that you are doing what you need to do in terms of alcohol after surgery. And then finally, we're just going to review a few important things that you need to know and keep in mind as you're going to surgery. So what we're going to start out talking about today is planning ahead. I want to make sure that you take time to plan for yourself. Planning plays a large role in your adjustment after surgery. And so it's important to make sure that you're looking ahead and trying to see what things you can plan for. Planning is going to be very important to making sure that your coping and adjusting after surgery is as easy and simple as possible. One of the things that you need to make sure that you do in terms of planning is think about your role in your family. Are you the cook in the family? Are you a caregiver? Planning who's going to help fulfill some of those roles is going to be very important. Now, you're not going to be an invalid by any means. You're going to be up, you're going to be moving about, but sometimes it helps to have some extra help. In terms of your job, working, you need to plan how much time you're going to take off. We generally recommend you take at least 2 weeks off. If you have a job that's pretty physical, that has a lot of pushing, pulling, bending, stooping, lifting, you might need to take a little more time off. So planning around when you're going to return to work will be very important. It's also important to think about your role socially, friends, family. We do a lot of socializing around food. And so what are those major holidays or family get-togethers that you will spend a lot of time eating, and how are you going to handle that? So all of these are going to be important to your post-operative coping and adjusting. One of the things that you can do to try to minimize stress is make sure that you might get a little support where you need it. If you commute to work, you might want to drive with someone else. You also might want to spend some time having someone lined up to help in roles where you are a caregiver. Who's going to help take care of your children? Or if you have aging parents that you help take care of, that's also going to be important. Making sure that you have a good plan in place. I want to spend a lot of time today talking about what to expect. Patients often have a lot of questions about what is it going to be like after surgery, and so I want to fill in some of those blanks for you today. First, you can expect to have some emotional coping and adjusting difficulties after surgery. Now, I don't by any means expect you to be clinically depressed, and a little later we're going to talk about what some of the signs and symptoms of depression are. But you can have emotional ups and downs after surgery. Now, generally that's due to several things. We're doing the surgery in your stomach, which houses a lot of hormones, and those hormone levels drop drastically. We're also cutting in your gut. Your gut is where most of your serotonin is housed. Serotonin is your mood neurotransmitter, and it plays a large role in depression and anxiety. So you can have some emotional ups and downs after surgery. Also, when you lose weight drastically, your hormone levels and hormone production changes, and that can cause some changes in your emotional coping and adjusting. You may also feel an emotional letdown as your energy reserves are drained. And this is very common. You're taking in less calories before surgery, and then immediately after surgery, your calorie intake is going to be much lower. So you're going to be tired, and that can weigh on you emotionally as well. So just making sure that you're taking care of yourself is going to be very important. You may experience what is often described as low frustration tolerance, and that just means that you don't tolerate things as well as you generally do. So there might be things that bother you that generally would not bother you. Don't worry, though, there are some things that you can do to help with this. One of the best things that you can do for yourself is keep as much structure in your day as possible. Making sure that you're going to bed at the same time and getting up at the same time is very important for helping with your mood. Often when we don't have our daily schedules the same, like we're not working or it's the weekends, we kind of get off. So make sure that you are going to bed, getting plenty of sleep, and that you keep your day as scheduled as possible. Exercise plays a huge role in your stress management, and so it's going to be very important to make sure that you're getting exercise. I'm not talking about going to the gym. Just walking daily is going to be important to help with you emotionally. It'll help with your mood. You want to make sure that you also identify and use your support system. Now, I said identify and use because my patients are very good at identifying support and telling me who's going to be there to help them. We're generally not as good as asking for help. So I really want you to focus not only on identifying who can help you, but getting a little bit better at asking for help when you need it. Another big part of emotional coping and adjusting after surgery is buyer's remorse. And I want you to know that it's very common if you experience buyer's remorse. Buyer's remorse is just feeling guilty for purchasing something or doing something or feeling like you made the wrong decision. And it is completely normal if you wake up the day after surgery and think, oh my goodness, what did I do? Or why did I do it? I want you to know that it's common. It happens to lots of people. And the big thing is not to panic. It's very normal. Some things that you can do to help with buyer's remorse, as I said, is don't panic. It is common. Focus on the primary reasons that you decided to have surgery. What were the benefits that you were looking for? What were you hoping to get out of this process? Focusing on those can help remind you that, no, you did make the right decision. Take one day at a time. You might find that if you're trying to look at the whole thing, how am I going to do this the rest of my life, it can be overwhelming. But if you just focus on today, you'll be okay. And if today is a little bit too hard, just focus on this hour. What do I need to do to get through this next hour is going to be very important for you. Finally, make sure that you have support. Again, it often helps to have support, and that will help with dealing with buyer's remorse. One thing that I want to make sure that you understand and I want you to be vigilant about is don't suffer in silence. If for any reason you're having difficulty after surgery, I want you to call me. I want to hear from you. So if you're struggling emotionally, if you're having difficulty coping, or if you're experiencing any kind of depression, please give me a call. I want to talk about some of the signs and symptoms of depression because often we forget what they are. And so I want to make sure that you know the symptoms and you give me a call if you experience any of these. If you have an extreme loss of interest in daily activities, and that just means you don't want to do the things you typically do, please call me. I need to hear from you. If you find that you're sad most of the day or more than not, that doesn't mean that you're happy all the time. It means that you're sad more than you're not sad. Please give me a call. If you find that you're unable to sleep and your sleep is severely disrupted, you've been up for days, please call me. It is very common to have a little bit of sleep disruption after surgery, but if you find that you can't sleep at all, day or night, I need to hear from you. If you're sleeping much more than usual, I also need to hear from you. Now, it is common to be tired and have some fatigue. However, if you find that you're sleeping most of the day, don't want to get out of bed, please call me. I need to hear from you. If you find that you're withdrawing from family and friends, don't want to be around anyone, you're isolating yourself, please give me a call. I need to hear from you. And finally, if you find that you have thoughts of harming yourself or suicide, I definitely need you to give me a call. I don't want you to suffer in silence. And while I do expect you to have some emotional ups and downs, I don't expect you to be clinically depressed. I want to spend a little bit of time talking to you about relationships in surgery because this is an area where many of our patients have questions or they have concerns. First and foremost, whenever you decide to have surgery, even though it is a personal decision for you, it does affect those in your lives. So in your families, in your marriages, in your relationships, anyone in relationship with you will be affected by the changes that you're making. I want to make sure that you know that just because you've had all of these months to focus on getting yourself ready for surgery and preparing for surgery, that doesn't mean that your family has. And sometimes they can feel a little overwhelmed with the changes that you're making, particularly after surgery when there's so many lifestyle changes that have to happen. So research has found some good information about this, though. One thing that we found is that when a person decides to have bariatric surgery, that often it has a halo effect in the family. And that just means that other people generally lose weight, partially because they adopt the lifestyle changes that you will be making. Some patients do have concerns for their marriages or their relationships after surgery, and I want to make sure I address that. What we found is generally that the state of a marriage before surgery is pretty much the state of a marriage after surgery, and that's true of any relationship that you have. Bariatric surgery in and of itself does not cause divorce. But if there are problems in your marriage before divorce or in your relationship before divorce, those problems will still be there after surgery. If your marriage is in pretty good shape prior to surgery, then we would expect it to be the same after surgery. Research does show us that there's some good things that happen in relationships after bariatric surgery. One of those is that sexual libido generally improves, and another is that sexual performance improves. So even though there are lots of things that change in your relationships, it's good to know that there's some good things that can come out of them too. Just to keep you on board and give you some things to help with managing your relationships, I want to talk about a few things that you can do. First and foremost, include your spouse or significant others in your visits. We encourage you to bring them with you. We encourage you to bring them to your education classes. We believe that the more informed they are about the changes you have to make, that the better they can help support you. So please bring them with you to your appointments. Talk with your family about surgery. Talk with them about what you're going to have to do and make sure they're aware of some of the changes that you're going to need to make. Often, a lot of times, there's a lot of anxiety out of the unknown, not knowing what to expect. So make sure that you help your family to understand what to expect. Be open if something bothers you. Use assertive communication and communicate with your family members as much as possible. And then finally, we also want to make sure that you're making small changes in your home. Often, when it comes to making changes, we want to do everything all at once. And again, remember, your family has not had all of the months of time of change that you have had. So please make sure that you're making one change at a time or gradually within the household so that family members have an opportunity to get used to those changes. It's also important to monitor the health of your relationships, and you may need to minimize any relationships that are negative or have a negative impact on your life until you're a little further along out past surgery and can deal with them a little bit better. I want to make sure I spend some time talking about body image. Body image is a huge part of who we are and how we see ourselves, and it's not the actual physical way you look. It's your mental picture of yourself. And patients often expect that immediately after surgery that their body image will get better and it will change as their bodies changes, and that's not true. It's not a linear relationship. Your weight loss will occur much faster than your body image changes. Remember, it's that mental picture of you in your head. So you've had lots of things that have influenced the way that you see yourself and how you think about yourself, and also just how you look at life in general. So it's going to be very important that you know that your body image will not change as fast as your weight loss changes. The numbers on the scale are going to go much faster than it takes you to get there and be comfortable with who you are in your body. There are some things you can do to help with managing body image. Some very concrete things like take a picture of yourself every so often after surgery, maybe once a week or so that you can actually see the changes in your body and start giving yourself concrete images of the changes that your body's making. You can also try on old clothing. A lot of times we get very excited after surgery and we say out with the old and in with the new, but hold on to some of those older pieces so that you can try them on, maybe even when you're having a rough day, to remind yourself you may not be where you want to be yet, but you're not where you used to be. It's also helpful to have a family member or a friend point out someone out in public that's about the same stature as you are. You won't believe it. It will be very hard and you'll say, no, that's not the size that I am. But it's very good in helping you to kind of reform that picture of yourself and of your own body image. There are lots of things that you can do to manage body image, but if you're struggling and you're really having a hard time, please call me so that we can talk about it. I know that you've already gotten information about alcohol use after surgery, but I definitely want to spend some time talking to you about it. Research has shown us that adults who have bariatric surgery are at increased risk for having alcohol use dependence disorders within the second postoperative year. Now, there's a few reasons. First and foremost, you should not have any alcohol within the first year after surgery. That's one of the reasons why we see an increase 2 years out. I want to make sure that I talk to you about some of the changes that your body can experience after surgery with regard to alcohol. And I know that the nursing staff has spent time talking about some of the technical changes, and I want to talk in everyday terms about it. Some of the things that can happen after you've had particularly gastric bypass, but other surgeries are now being researched, is that your body metabolizes alcohol differently. And what that means is that the time it takes to have an effect on your brain is much shorter. And that means things like becoming inebriated or drunk happen much quicker. Also, the level of alcohol in your blood is much higher. So we want to make sure that you're being safe. I definitely want you to be very thoughtful and careful about having any alcohol after surgery, but keep in mind that you are not supposed to have any alcohol within the first postoperative year. There are some things that you can do to prevent alcohol use disorders, and the biggest thing you can do is abstinence. Just don't drink alcohol after surgery. If you do decide to have alcohol after surgery, please make sure that you limit your use of alcohol and that you do it in a very safe manner. Again, because the way that your body metabolizes alcohol will change, make sure that you're doing it in a safe environment, that you're not the driver, and that you're not responsible for managing anyone or anything during the time when you have alcohol. Please call us if you have any concerns, if you feel like you become dependent on alcohol or any substance, or that you have compulsive behaviors, which just means that you feel like you can't stop doing something. Please call us because we may need to make a referral for you. At the end of the day, you have to develop behaviors that support a healthy lifestyle. It doesn't matter which weight loss program you use, you have to make sustainable changes that you can make and maintain the rest of your life to have good weight management. So please make sure that you're making sustainable changes. The changes that you make to your eating, to the way that you manage your lives, to exercise, are all things that you maintain, not just in preparing for surgery, but well beyond and after surgery to support your weight management overall. We want you to know that we're here for you, and if you need support, we want you to give us a call. Please call the office with any questions or concerns that you have. If you feel like you need more social support, we have a wonderful support group that meets monthly over at the conference center at the hospital, and that's a great opportunity for you to meet and talk with people who've gone through what you're going through or who are living what you're experiencing right now. So I encourage you to attend the support group because it's a great resource for all of our patients. Finally, please make sure you give us a call if you have any questions. I am so excited about you getting to this point and about you pursuing surgery and finally getting to the point of surgery. If you need additional support from me, please call the office and let them know, and I will contact you or we will see if we can get you on my schedule. I hope that you guys have a great surgery day, and I'll see you soon.